Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. I just took off my mask. Doesn't say whether it's one party or another, what my philosophy is. All it does is protects you against this insidious virus. So I would just suggest that take my word for it. It does work. So wear your mask. Today we have two individuals from the Nicklaus Children's Hospital Heart Institute, which is not only recognized by the folks here in the state of Florida, but recognized throughout the United States as part of a system which is really preeminent. So let me introduce the two individuals that are guests today. We have Dr. Lourdes Prieto, who is the Interim Director of Cardiology. Welcome, Dr. Prieto.
Thank you. It's a pleasure to be here.
And a return person to us, Dr. Danyal Khan, who is a pediatric cardiologist. Welcome, Dr. Khan.
Thank you for having me.
Yes, we're glad to see you again. We've had a lot of comments. As I always say, this is really the people who view us, give us all of the questions, and we go through them. And there was a lot of, interest in pediatric work, dominantly in the area of cardiology. So I said, well, let's get some folks here who know not only what they're doing, but are excellent at what they do. So we have Dr. Lourdes Prieto and Dr. Danyal Khan. So Dr. Prieto, let me ask you first, as the Interim Director of Cardiology, what is the Children's Hospital Heart Institute?
I think the most important goal of having a cardiac institute is bringing multiple subspecialists together to treat a condition. So in the more traditional setup, you have different subspecialists sort of in their own silos, in their different departments. For what we do for congenital heart disease, we need a multitude of subspecialists coming together, thinking about the patient together under the same roof. And that's really what an institute does. It provides patient-centered care so that we have everybody who has something to offer to the patient talking in the same room and following the same guidelines and coming together as a group. I think that's the most important goal that an institute brings to patients.
To be candid, you're echoing what we preach here in our healthcare programs at Nova Southeastern, and dominantly in our medical schools. We have two medical schools, as you probably are. If you're not aware of it, we do, both DO and MD schools. And we teach, not just preach, the responsibility of being collaborative.
That's exactly right. I can give you an example. For example, we have cardiac anesthesiologists, cardiac radiologists. In addition to the cardiologists and the surgeons, all of them have to be involved with every patient. So having everyone together just makes for a better outcome.
Dr. Danyal Khan, sir, you are a pediatric cardiologist. Tell us about your work efforts.
So, I do pediatric cardiology. I also do adult congenital cardiology. So in our heart institute, we take care of patients all the way from fetuses all the way to adults. Nowadays, most of the complicated congenital heart disease is diagnosed even before the babies are born. So the obstetricians will be screening the unborn fetus they have a protocol that they follow, and they'll look at the heart, and most of the complicated heart problems are picked up even before they're born. So we started following our patients all the way from fetuses to the time that they're born. If they require heart surgery or some kind of procedure, they get that done. And then we keep on following them for the rest of their lives. A lot of our patients who have complicated heart problems, they also require other specialties. So apart from cardiology and cardiac anesthesia and cardiac surgery and cardiac intervention, sometimes they might require other things, like they might require the neurologist to follow them. If they have any issues, they might have lung issues and they might require a pulmonologist. The chances of the kidneys getting affected are higher than the general population. So we have nephrologists who specialize in cardiac, in babies with cardiac problems. So they usually require a multitude of subspecialists. So at Nicklaus Children's Hospital, we provide a comprehensive care for our cardiac patients, all the way from fetuses all the way to adults. So I do pediatric cardiology. I also take care of the adults with congenital heart disease, and we follow our patients as long as they're with us.
I would assume, and again, you both can jump in on this, that as your learned knowledge as to care and the new methodologies, for example, minimally invasive techniques, robotic work, et cetera, I would assume that your ORs have changed dramatically over the last 5 to 10 years. True?
Yeah, that is very true. Maybe I can speak to that a little bit. So my specialty is catheterization or interventional cardiology. More and more, many procedures that used to require open heart surgery, we are now doing in the cath lab, with a procedure that basically is like an outpatient procedure. The patient comes in the morning of the procedure, goes to the cath lab, we do it, we observe them, typically one night, and the following morning they go home. So, for example, we can now replace a valve in the heart in the cath lab, the pulmonary valve, the tricuspid valve, as opposed to needing to open up the chest and have the patient, stay in the hospital for a week to recover afterwards. So that's a big advancement that's been taking place in the past decade or so. We're also now able to close, let's say, abnormal vessels in very tiny premature babies. So as little as 700 grams, we can go with a catheter in the cath lab and place a little plug in what's called a patent ductus, which is a vessel that premature babies often have, which leads to lung problems and heart failure. And those are things that, again, used to require surgery, and now we can do them non-invasively or less invasively in the cath lab.
It's very interesting, Dr. Prieto. All the years that we've been doing this show, the top 3 issues that the public, our viewers, always ask about is, they always ask about cardiology, cardiac issues. They ask about the question of minimally invasive techniques, and of course cancer. Those are the 3 top issues they talk to us about. But the minimally invasive techniques, they are always, we always get responses from the audience, because they are really totally amazed, because, remember, South Florida is a community which has the greatest number of people, percentage-wise, of over the age of 70, and the largest number of people over the age of 80 of any state in the union. So, they remember the open heart procedures, but they always relate to the open heart procedures as pain, blood, long hospital stays, etc. And when they have grandkids or great-grandkids or whatever, they want to know these questions. So that's why I was hoping to get both of you on the show, because I'm glad to hear that exactly what you just said, the opportunity to be able to do these things as quickly and as less invasive as, I guess that's the words, as was previously done, is really a wonderment to the people who have asked these questions.
I think we live in an era where science is rapidly advancing. If you were alive 100 or 200 years ago, there was no hope that during your lifetime anything would ever change. Nowadays, phones, computers, technology, software, everything improves every year. And similarly, everything in the healthcare world is also improving at a fast pace. So, catheterize, usually the procedures that are done for cardiology are either catheterization or surgery. I think both of the techniques rapidly improve. The surgeons have also become, much better at their surgical techniques. The incisions that are used now to do open heart surgery are much smaller as compared to before. I think the equipment that they use is much better, so the recovery times are better. Nowadays, we use a lot of local anesthesia. So instead of using medicines that like morphine type of medicines, you can inject local anesthetics right next to the incision. And they stay in your body for a few days, and your requirements for pain medicines goes down. There are techniques to preserve blood so that the requirements for blood transfusion go down. So I think the surgical techniques are becoming better. They can do more things robotically and through specialized instruments, through smaller incisions. The catheterization techniques, of course, are much better, and we keep on having a lot of advances. We also have other techniques that are used to plan our procedures better. Previously, we were relying on catheterization as a tool to diagnose heart problems. Nowadays, before the surgeons go in, we already have everything that we need by ultrasound, echocardiogram, three-dimensional echocardiogram. We also use CAT scan and MRIs. So we can use CAT scan and MRIs to actually print out a heart of the patient to show exactly what the heart defects look like. So the surgeons can basically hold the heart in their hand and see what it's going to look like even before they open up the chest. So they're kind of mentally and psychologically ready to deal with the heart problem. So there are a lot, just like everything else in science and medicine, in science, medicine is advancing rapidly. And nowadays, all of the doctors have become kind of super specialized because everything has become, there's so many things to learn that all of us kind of have our own kind of niche that we deal with. But in cardiology, there are a lot of advancements made. In the adult world, heart problems are very common. So if you live long enough, everybody will probably need to see a cardiologist. In the pediatric world, out of all the organs where something can go wrong, the heart is the commonest place where something goes wrong. About 1% of kids will have a heart problem. About half of those will actually require a procedure to be done. Half of those heart problems are minor enough that we don't do anything about it. But the ones who do require heart procedures or something to be done, nowadays it can be done very efficiently, very safely. The chances of being successful is extremely high, and usually we can get them in and out of the hospital by spending a minimal amount of time in the hospital and minimal amount of pain.
I'm glad you touched on it because I think we're going through, this is just my observation, you've both been at this for a while, and I'm not going to say how long, but for a while. And the changes are dramatic. I know because, in creating the new medical school in Clearwater, Florida, we're not using the traditional teaching methods for anatomy. We're doing everything on 3D, optical. All the students can literally hold on to the heart, for example, and work the issues out. I think it relates to a new era of healthcare, which enables them to understand that they're not just sitting there learning anatomy alone. They're there with the anesthesia assistants, with the nurse professionals that are specific to that subspecialty area, et cetera, et cetera. So I really believe that that healthcare is moving very rapidly with a new sense of not just knowledge, but cooperation. And I used the word before, collaboration. I really think that that's the main issue. It will bring a much quicker and healthier society. What do you think of that, Dr. Prieto?
Absolutely. I think we are having more and more physician extenders work with us. And I think bringing people with a different kind of training to the picture also adds to a better patient experience. Our nurse practitioners are excellent at providing not just medical but psychological care to our patients. I think it provides for just a more humanistic approach to the patient all around. Absolutely. I think you're absolutely right. If I could add a little bit more to what Dr. Khan was talking about, I actually have a cardiac heart model right here, a three-dimensional model. I don't know how well you can see this, but what this allows us to do, especially for somebody like me who does put some devices inside the heart, I can actually take this in my own hands and put the catheter inside of it, place the device, and see exactly how it's going to look in the patient before the patient ever gets to the cath lab. Our surgeons also are working on actually using augmented reality to look at the anatomy inside the heart. So I think one day we'll be able to bring something like that into the OR, and they'll be able to look at the heart on a computer before they go in and do something inside of it. And understanding the anatomy before you get inside is a crucial part of being able to have the best outcome possible, either for what I do or for what the surgeons do. So yeah, we're using a lot of multi-modality imaging to understand our patients and do the best technical job that we can do.
These 3D hearts are not like the hearts that you can buy on Amazon. These are kind of custom printed hearts, which are the patient's, basically the patient's own heart. So they are taken from CAT scan or MRI images. They're printed on a 3D printer, that we have in the hospital, and they're printed to the actual size. So you can actually see what size the patient's heart is going to be, what size their arteries and heart chambers are going to be, what size the holes are going to be. So you can basically replicate exactly, what things are going to look like once you get inside.
Well, I'm glad you brought that up because, again, not to this is your show, but here at Nova Southeastern, we have 3D printers that are available to our healthcare programs, and in Clearwater we have 4 of them. So it's very important because they get to see something and hold it little. I mean, there's something about the tactile nature of holding something that you are working on with minimally invasive technique.
I think for the students, in the last millennium, when I went to med school, we used to basically dissect out, bodies, dead bodies that had been donated. But nowadays, as you know, that's a thing of the past. Nowadays, everything is 3D printed. We have better images that are available in holograms, animation, augmented reality, that that are better able to teach the students. So for teaching, all of their multiple tools that are now available thanks to faster and better computers. It's also easier to explain to the parents and the patient what the problems are and what we're going to be doing and how things are going to be fixed, rather than drawing diagrams on pencil and paper. So they don't have to put up with my terrible drawing. We can just show it to them exactly what's going on and how things are going to be done. So I think for students, patients, family, the lay people, all of these are great tools that we can use now.
We had an interesting question from one of our viewers, and either one of you can get into this. I think it was a grandma that sent in the, I think it was and asked a question about, she had some, years ago, open heart surgery, then recently had some minimally invasive surgical technique, had a stent, and she's been doing cardiac rehab in facilities, for quite a while. What happens with a child that's worked on? Are there rehab schedules to either one of you?
It's amazing how quickly children bounce back from cardiac surgery. I'm always amazed when I see them back a week after surgery. They're basically back to their baseline. So unlike adults, they don't frequently require rehab at an early age. Now, as they get older, and Dr. Khan should speak to this a little bit more because he's our director of adult congenital. As they get older, they do require more help to get back to their baseline. So actually, Dr. Khan is working on getting a program of cardiac rehab going here at Nicklaus Children. So maybe you can speak to that, Daniel.
So in the adult world, for adult cardiology and adult cardiac surgery, cardiac rehab is a well accepted kind of phenomena that everybody who undergoes heart surgery afterwards would undergo up to 3 months of rehab just to get them up and going. Babies, when they're babies and young kids, toddlers, or kids in elementary school, they're very resilient. So they're usually up, and by the time they're leaving the hospital, nobody can believe that they have undergone heart surgery. And usually what I tell them is that as long as they keep their shirt on, nobody will ever be able to tell that you had any heart problem, because they do so well. So we are finalizing our cardiac rehab program, which is a new thing in the pediatric world. So for kids 10 years and above, we would have a formalized 3-month program where they come to the hospital. This is going to be mostly be done by physical therapists and occupational therapists. And they would go through a 3 times a week schedule for 3 months, just to get them up and going and to get them ready for the real world. The parents and patients are also kind of apprehensive about their skin incision, about how much exercise they should do, whether it's okay to go back to school, whether it's okay to carry a school bag, are they able to go upstairs in their school or not, when should they resume PE at school. So this is kind of to help them do that. So we should be up and running with that in the next couple of months.
Good. Believe it or not, we're down to the last 5 minutes of the show, but I got so many questions. Just one quick thing, nutrition. Obesity is the blight on the young of our nation. I'm sure it goes all the way down to the children, all the way down to kindergarten. So I'm just wondering, do you see a lot of that causes you to be involved in operative procedures?
It is an epidemic, unfortunately, that we, as pediatric cardiologists, we should take some responsibility to help with. I'm going to let Dr. Khan, who is a very busy outpatient cardiologist, talk about that. I am more of an inpatient and invasive type of cardiologist. But when I see my patients, I go over, diet very carefully. We try to counsel them as much as we can about exercise and not smoking and things like that. But obesity is a big problem that all of us need to try to tackle in this country. Absolutely. So Daniel, you should talk a little bit more about that than I do.
As all of us know, there's an epidemic of obesity. As pediatric cardiologists, we were originally trained to deal with heart problems from birth, but nowadays we have to deal with all of the heart problems that adult cardiologists used to deal with. So hypertension, obesity, diabetes, high cholesterol, that a generation ago was kind of non-existent in kids. We deal with all of that nowadays. I think what I find is that less than 10 years of age, kids their weight is okay. They could even be skinny. And usually the parents and grandparents try to show their affection by trying to feed them. Chubby babies are cute, but what we end up what the phenomena that I end up seeing is that the first 10 years of life, parents are trying to tell their kids to eat more. And once they become teenagers, all of them are overweight. All of them, have the issues that adults have, like high blood pressure and diabetes. And then we're telling them to eat less. And once the weight goes on, it's very difficult to get it off. We are also the indoors generation. A generation or two ago, everybody used to be outdoors. Everybody used to play outside. And nowadays, especially in Florida, we prefer to stay inside in air conditioning. Nobody really goes out to play. We're also, I think, concerned about our security. So we are also more concerned about letting kids go outside and roam the streets. So I call ourselves the indoors generation. So the usual recommendations for exercise in the pediatric age group in less than 18 years of age is 1 hour of aerobic activity at least 5 days a week. So it is very difficult to actually achieve that. All of us are addicted to screens. If you check your screen time on your phone, you'll be amazed that you are spending 3, 4, 5, 6 hours a day on your phone. So all of us are addicted to screens. Previously we used to talk about rationing TV times for kids, but nowadays we have to ration screen time because kids don't watch TV anymore. They watch computers, video games, YouTube, online streaming. So you have to watch their screen time. The 1 hour of aerobic activity per day, I think the only way to achieve that is to put kids in after-school sports because nobody goes out to play. So you have to have something scheduled in your daytime to be active and to do aerobic activity. And as far as diet goes, I think the typical American diet is too high in carbs. Everything that tastes good is basically, we've come down to that everything that tastes good is not good for us. Anything that's packaged, fast food, all of those are very high in carbs. They taste great, but they're all high in carbs, and our total carb intake is too high.
I don't mean to interrupt you, but we're down to the last 30 seconds of the show. I wanted to thank you, both of you, Lourdes Prieto, Interim Director of Cardiology at Nicklaus Children's Hospital Heart Institute, and Dr. Danyal Khan, a repeat. You're back again. So we'll get you back again, who is a pediatric cardiologist. And we thank you both, not only for what you do, but for your advocacy, which is really to be blessed. And we want to thank you both for what you do. So thank you very much for being here today. Remember, folks, this is your show. This is your show. If you have any questions, there's an email address and a telephone number right here. And remember, if there's something bothering your children or otherwise, don't just put it off. Make sure you tell the pediatrician. Make sure you tell the general practitioner, whoever is taking care of your child, just like yourselves. You can't hide these things. You can't go into supermarkets and pharmacies and buy things to cure things without letting them know what you're curing. So please communicate with your doctors. Remember, this show is called Dateline Health. We come to you from Nova Southeastern University, and my name is Fred Lipman. Until next time, see ya.